wait, I'm not on mute. I'm not on mute. Okay. Okay. I thought I was on mute.
Entry. Let's try that again. Let's try that again.
Bring
Start
it
it up.
back.
Bring it
RODeo
back.
round 5 is live. Had some
Let's.
technical difficulties. Elon rugged from the sky, but we're back online. We're back
Yes.
online.
What do you think
Let's-
Elon's saying from the sky up above?
He's saying it's spite. He's literally like spiteful that he's still not on the rod, I think.
I can't
All
say
right.
I'm super upset about Elon Musk because he was totally screwing up the experiment. Maybe we'll have to go back and do some replays, but if you look at like his times on the rod, they went down. He basically outsmarted the whole system. He was jumping off like as fast as he possibly could. He hated running.
He literally forfeited the RODeo every single week.
Yeah,
Every
and,
week.
well, like he wasn't the gamer that we thought he was.
No.
So I can't say I'm upset.
All right,
That
let's
being
see. This is the
So-
male warm-up.
Yes.
So this is not the first round on the rod. All right. I'm gonna pop over to. Can you hear the music?
Yeah, it's super quiet though. If you want to
Oh,
juice
I-
up. a little.
Is it super quiet? It's always me. I always play it so loud. Okay. How's that?
Perfect.
Clearly, I've cooked my ears down through the years. Okay, popping in the stream.
All right, so before we get too deep in this, like, what are you thinking about markets right now? Do you think we're up only is resumed?
Here's to hoping, man. I don't feel like it can go much lower, but you know, jeez, it's been brutal.
Everyone was getting real bears there for a second. I think we're back.
I think we're back, baby. We have to be back. This was not the bull run I was promised.
Yeah, no.
I feel like it hit us right at the knees.
I feel like there's all these like market gurus who are on Twitter like drawing a bunch of lines, like, making it look like, everything's perfect, and then they're always wrong. They're always wrong. Every single time. How are they always wrong? It's like they want people to take the other side of their trade so they can dump on them.
I feel like it's just like people are constantly like, I found the signal, and I'm like, I mean, have you? Because then,
Sure.
at least there's so much macro stuff going on that I feel like all of that analysis to me is just almost like, I don't want to say out the window, but man, there's so much like volatility and decision making, at least in the US, that it's like, I don't think anything can be priced in.
Yeah.
Chaos is probably the only thing priced in. Strap in, volatility is probably the new norm.
Yeah. And I always thought that like as markets matured, they would get less volatile and more like steady. Nope. Opposite. Information travels so fast now. Everyone responds so much faster to news. Way more volatile.
It's so interesting. Like I was reading something where it's like, I mean, I'm sure you've seen too, like at least in the United States, like social media now like is the news. You know what I mean? So like you said, if it's not on social, or once it's on social, like that is how people get their news. So it goes wicked fast.
So fast.
And even like who's going into the, presidential press releases is not the normal news.
Yeah. What was the craziest Trump activity of the week in your mind? I don't know how much you were following.
All right, this is gonna get a little.
Get a little nicey.
It's gonna get a little nicey. I don't even know if I should wade into it, but starting to release. I don't even know if it was like a Trump thing, but yesterday some of the Epstein files coming out. Ugh.
Oh, did some of them come out?
Yeah, but it wasn't anything like earth-shattering. Like I feel like it was stuff that everybody knew, but they were like, "Oh, the FBI is like withholding stuff and like destroying files." So now, like, I think that there's more. But yesterday, a bunch of like, speaking of like social media being the news, a bunch of like influencers were walking out of the White House with like embargoed binders of the Epstein stuff, and like that was how I feel like the news got out that like the Epstein files were going to be announced later. It was all still under embargo, but yeah, a partial release. So it has nothing to do with the tariff swings. I've I think we're owed that list personally, but
Totally.
apparently RFK's mom was like on that list.
No way.
Yeah, I don't know in what
This
capacity.
is Kennedy. You dog.
I know. I don't know if that could be I don't want to be spreading rumors, but I feel like I saw that headline and was like, what?
That's
Not quite who I thought would be on the Lolita Express. Was it the Lolita Express? The plane?
I think that sounds right.
Yeah. Okay, what about you? Clearly that's what I thought was interesting.
There were a few things. Trump Gaza was maybe the craziest thing I've seen.
Oh my gosh.
I cannot believe that's a real that happened. Like,
I just can't believe that was on like official comms. Like AI generated.
Yeah, by the way, do we know when they're starting it?
Let's see. This was supposed to be the warm up.
Is it still going?
Oh, round 1, 10:38. Just started. Okay, glad you're paying attention.
Somebody's got to pay attention to these mice.
Somebody must. I'm like over here talking about the Lolita Express, and you're like, pay attention to our science.
Well, the other crazy thing was one of the reporters was like, so, President Trump, you called President Zelensky a dictator. Like, what are your thoughts on that? He goes, I said that? Wow, that's like, he's like, I said that? Wow, I can't believe I said that.
Kind of like, did I say that?
Didn't deny it whatsoever.
Oh, must have said that. He's such a riot man. I don't know. I will say he's like making stuff happen. There's something every day.
Totally.
This presidency has felt like 4 years smashed into a month and a half. A month. All right. Oh, is someone going down? Wait, real quick. I think we should update people. So, okay, the mice far exceeded our expectations. The max limit on the RODeo that we had was 5 minutes, and Michael from Tracked Bio thought that this was a good baseline for how long the mice would stay on the rod. And these are age mice that we're using. What we were finding is actually a couple of the mice the last few weeks stayed on the rod multiple times for the full 5 minutes. So the rod was actually shutting off with the mice on it. And so obviously this is an experiment. We didn't want to disrupt like the integrity of the experiment, and there's an ethics review board. So we put forward a proposal, Benji, like a couple weeks ago?
Yeah, it wasn't even that long ago. It was maybe like a week and a half ago.
Yeah, to increase the amount of time, the max time on the rod. So today is the first time that the max time on the rod has been upped from 5 minutes to 10 minutes. So hopefully we can actually see how long, like Lionel Mousy, who's been crushing it on the rod every single week, will stay on the rod, because she's been sitting at the top at least 2 rounds on the rod. So TLDR, the max time on the rod went from 5 minutes to 10 minutes. We'll see how they do.
Now we can actually test them, because before
for real
max now.
Oh, let's see. Is that Mice Jordan already spinning?
You bet it is.
Here we go.
What was I going to say?
I have something to say. We have a guest.
Well, yeah, I mean, I guess all I was going to say is like, I'm finally glad to see like if Euro's working, because like Euro was getting trashed by Elon Musk and by Lionel Mousy, who just like maxed out. So
yeah,
because like, she finished like basically had it capped out. We don't know how long she can actually go. So is Euro actually helping her? Like, we didn't know. Like,
we'll find out.
Yeah, we'll find out. And then same thing with Elon, because like he wasn't actually staying on and just jumping off. Like, we have no idea if Euro's working.
Yeah, no, that's true. Euro had like the 2 biggest I don't even know if you can call them outliers, but the top performer and the bottom performer, and we were capping the top performer. So now we can see how good the top performer actually is.
Yeah.
All right, let's see. So Lance Hairstrong, out. Harry Bonds, out.
Out. Mice Jordan, Kevin, KD.
KD, the ballers. Oh, spoke too soon.
There she goes.
KD out. Mice Jordan clocked a couple good performances. So, I mean, I think Mice stayed on the rod, I want to say at least like once. So let's put this
You mean
legend
full
to the
time?
test. Yeah.
Yeah.
Here we go. Here we go. Did you start a timer? Because I forgot I was yapping.
Yeah. I'm at like 420.
Okay.
But I don't know how much lag I had, so we'll see. Let's go, Mice. Here we go, Mice.
Let's go.
Andy's gone.
Come on.
Oh,
Come on.
he's still there. Wow, what a ledge.
Upside down. Upside down.
Okay, I clocked him at 434. Pretty
solid.
From Mice.
Pretty solid.
Well done, Mice.
Did we increase their break time to 10 minutes?
No, their break time's 5 minutes, which to them is apparently an eternity.
2 hours, I think Michael said.
Yeah.
2 hours.
Yeah.
Thank God. I was like, if we have 10-minute breaks, we're gonna have to like really start to get some shenanigans up in here to keep this interesting.
Yeah, you're gonna have to like put on a costume, put on your son's freaking Darth Vader costume, and I don't know.
Oh my gosh! You know, I did. Oh! Should we bring him back? What do you think?
I mean, like, I do have mine actually. That's a lie. I totally have mine with me.
Benji, I feel like that was such a good, solid vibe.
Okay, fine. Give me a second.
Should I put mine on? Are we going back in the trenches with our goggles? Feels right. All right, we are on our 5-minute break. So for folks just tuning in, quick apology. We had some technical difficulties in the beginning. Elon Mouse rugged from the sky. But no, just kidding. We had some issues getting the stream connected to StreamYard. We weren't sure if it was StreamYard or some issues with the lab, but got it all figured out. So started a few minutes late. Just shared that we did increase the max time on the rod from 5 to 10 minutes. So actually excited to see how long these mice can stay on. For the last couple of weeks, we've had at least a couple mice staying on the rod for the full 5 minutes. So the rod was turning off while they were still on it, which isn't what we want to see. That doesn't let us test the full effect of the compound. So as Benji just shared this week, we'll be able to really see how long the mice can stay on and really get a much better gauge of the compound effect. So excited to see that.
Are you excited?
Yeah, I am excited, Benji.
You should be excited.
Oh my God, wait, is that a helmet?
Yeah.
Do you have on that?
You know, it's really dangerous out here, so you gotta be careful. You can't be too safe.
Stop, I'm dead. I'm dead. We are in the trenches, so it just feels like
this is the trenches.
Wait,
I'm right at it.
This is the trenches. Should I put my goggles back on? I don't know.
I don't know. I don't know. Do you have a helmet?
I don't have a helmet.
You gotta wear a helmet.
Well, okay. A helmet? I mean, I feel like I have like a bike helmet, which doesn't have the same effect. We do have a guest joining. I feel like I need to go put on I need to get a mask or something because we need some reactions here.
Is he backstage?
Not yet. So he said 5 to 7 minutes. So should be here soon. All right, I gotta see if I got anything around here. Hold on. Can you hold it down without me?
Yeah, what should I talk about? Prompt me.
See how it feels. Be right back.
Okay.
Oh wait, I didn't prompt you. Actually, one thing I do think you could talk about, Benji, is the worm experiments on Pump Science. They're like 98% complete. So I think it'd be cool to recap that because will they finish on this RODeo?
Maybe they will.
That's what I'm saying.
Yeah.
Talk.
Wow.
We
great
got science to talk about, fam. Let's go. Okay,
Let's
be right
go. All right, team. Should we dig into the science while Jillian's gone? The non-scientist is out. The PhD gens are in. Let's see what's good. Okay, let me pull it up. So yeah, we launched a few compounds on Pump Science over the last 2 weeks or so. I don't know if you were following, but just in case you were. All right, pulling up my screen. Let's make it a little bigger. Cool. So the urolithin and rifampicin are obviously my studies. We have 3 worm studies in the house. These are the 3 compounds launched in the past few weeks. Looks like all the artemisinin worms is dead. But I was looking at the data earlier, and it does look like it increases maximum lifespan, but there's definitely some separation here. So this is the Kaplan-Meier curve. This basically shows you how many of the worms in each group, so whether they got artemisinin or the control, like how many of them were alive at each time point. And what you can see is like some solid separation. What this means is that more worms were alive at frame 80, which is just like, this is basically time. More worms were alive that were taking artemisinin than were taking control. So it looks like artemisinin is going to increase lifespan of the worms, which is pretty freaking sweet. And then going into EGS, people on Twitter call it eggs. I mean, like
what?
this. No, this works. Like EGCG and sulforaphane like fully increases the lifespan of these fucking worms. Like, it doesn't take a brilliant brain scientist to see that like those.
Look at that separation. Ooh.
Look at that separation.
Love
those curves. I know how to spot curves. Those are some good looking curves.
Okay, when I worked in pharma, we would like to say that you could drive a truck through it. So I think you could fit a nice little truck through that.
You could like fit a Walmart. You could fit a Walmart between those lines. You could land a plane between those lines.
That's what you want. That's what you want.
So cool. And this one almost definitely increases maximum lifespan because you have to wait till 10% of the animals are dead, and then see are they enriched for like one versus the other. Fully the case. EGS increases lifespan of worms. Sick.
Oh,
Gossi.
Our guest has arrived.
Not looking good. Gossi's still questionable.
Ooh.
Story's not over, but we'll see.
Time will tell.
Should we go back to the mice?
Yeah, let's get back to it.
The mice are fully. Oh, you look great.
You're in a forever infinity.
You're looking fantastic.
Get us out of there. Get us out of there.
Oh, perfect. Yeah. Okay.
All right. Should we bring up our guest?
Does he know that he has to put on some like fancy headgear?
No. Well, did we know?
No.
Ethan, welcome.
Ethan.
How's it going?
Are you confused?
Am I confused? No, I'm entertained.
You're entertained. We decided to get in the trenches. We decided.
On the rotarod, yeah.
On the rotarod. Welcome. Real talk. Thank you so much for joining us. We are so excited to have you. I think, we wanted to start to bring together the DeSci projects that we're building in Solana and thought this was a great opportunity to have you come on board, talk about your mission. And yeah, I think just us also too, just like talk about the future of DeSci and Solana. So would love maybe to have you give some background on yourself.
Yeah, I got into biotech in 2013 and have been an operator in bio ever since. I got into crypto through actually Safety Namus, the guy who wrote the Bitcoin standard way back in the day. So I'm familiar with crypto for a long time, but never transacted and built a business on it because I'm not like a developer or DeFi or whatever. And then, I've been working on rare diseases as kind of my life's work for about the past decade. And what people don't realize is that there are 10,000 rare diseases In fact, today is, of all days of the year, Rare Disease Day.
No way.
That's awesome. That is awesome.
Yeah, it's sort of like, this is the one day of the year you're supposed to pay attention to rare diseases, and most people don't even know that this day exists. So there's a little bit of a problem with the rare marketing angle. The word rare doesn't really work. Maybe it works for rare earth metals. I don't know, but rare genetic diseases, and no one gets excited. So, but in any case, today is technically Rare Disease Day. Advocates and families and stakeholders are rallying in different cities.
Amazing.
I was actually going to be in DC last week, but then the NIH FDA Rare Disease Day got canceled at the last minute, which kind of sucked.
Does that have to do with everything going on with the NIH, you think?
Oh, yeah, I mean, obviously.
Yeah.
There's a bit of upheaval happening in DC, if you haven't heard.
I feel like it's like the NIH is being like dismantled, it feels like.
So there's chaos happening right now, and they canceled that meeting. But in any case, a bunch of rare disease advocates were in DC all week, and there are pictures of them going to Capitol Hill. That's what they usually do, is raise awareness to lawmakers. But in any case, I'm in rare diseases. It's my thing, my mission, and I launched Curetopia as the world's first rare disease DAO with Bio, the Bio Launchpad. And Curetopia has a utility token, Cures. It's live. The auction's live. We're the first Bio DAO to launch on Solana.
That is amazing.
Yeah, it's amazing that we did it when it was bottoming last week. When like, what the hell are you doing? But we have conviction. We build no matter rain or shine. Hail, sleet, whatever. It's not gonna hold us back.
Ethan, I have to tell you, I was so pumped to have you join today, because I know I had shared on the Twitter space, like some of my personal connections to rare disease, but I woke up this morning and one of my friends had shared like a link to donate to a fundraiser for her kid that had the rare disease that I had shared. And like, it's wild too, just to see when I had connected with her, I think like at the time there was only something like, I want to say like 150 known cases of like the super rare disease that ended up impacting their family. And like, to see when I clicked through to the link to like donate to this organization, it was all people who were impacted, and just trying to find like ways and avenues to get support. And when you think about how small that is, like, like all 150 people that are known in the world are probably like contributing to this. And the fundraising goal was like $3,500. Like, it was like not that much. And it just, I don't know, it just makes me realize like how much there's so much meaningful work to do, and to give these people like extra rails to actually have more ways to like fund research, have impact. So I don't know, I just woke up and the mission was like right in my face for what you're doing, and couldn't wait to have you come on.
I mean, everybody knows someone with a rare disease. It's just a statistical fact. 1 in 10 people are affected.
Wild.
And whether you need to have your eyes open to it, I ask people, just talk to your network. And if you don't realize you have someone, connected to someone with rare disease, you need to ask a little harder. You need to poke a little harder, but they're there.
They're there and like desperately need help and like resources, and have people who want to help and just need better avenues to do it, I would say. So grateful for what you're doing. I guess, Ethan, one question I have is like, why you think DeSci is, I mean, I feel like I've kind of touched on it a little bit, but would love to hear from you, like why, DeSci is a great avenue for like rare disease and people who want to have, get involved in rare disease research and impact.
Yeah, I mean, it's I get asked all the time, why now, why DAO, and DeSci.
Why now, why DAO?
Yeah,
you put that well.
Yeah, and DeSci is sort of it's matured to this point where it makes sense to build a fully native, Web3 native, blockchain native, however you want to say it, biotech company. And everyone, ever since I got into this industry, everyone talks about patients this and patients that, patients first and patient centered, and it's almost like, yeah, she doth protest too much. Like, you keep talking about how centered they are. Maybe they're not actually that centered when you look more closely. And that's the fact. The patients aren't in the boardrooms. They aren't in the labs. Um, you know, they're often just kind of, used in the beginning to just, get some resources, get research funded in academia. Who's doing that earliest de-risking work? Who's doing that essential, groundbreaking work? It's the families that are funding that. So anyway, I created Perlara as the first biotech public, benefit corporation, PBC, but I ran that experiment for the last 11 years, and
11 years.
yeah, it's my seventh
Wow.
year. So, and it's a sustainable, business now. Hopefully, if if the grant situation gets cleared up at NIH, then we should have some funding at some point to kind of so Pilar to have some funding to be kind of financially independent for the first time. But I ran the experiment of what happens if you try to partner with families in a trad bio setting on trad
What
bio.
did you learn? Because I think people think that that's really like, I don't think people realize how hard it is to partner in that way. But yeah, I would love to hear what you learned.
Yeah, I mean, any business partner is, there's, especially if you have like a very deep tech and high probability of failure business, like, you have to be really aligned. So, I'm very aligned with the co-founder of my second biotech, Maggie's Pearl. That's Maggie's mom, Holly, and we it's excellent to kind of work with a family from kind of an N of one study all the way up to a phase 3. And we're very
It's
proud.
not easy.
Yeah,
It's not easy.
proud of what we did, but it turned out that our phase 3 that we ran, we didn't hit our endpoints, and so we have to kind of regroup and sort of start over and test out some new outcome measures.
Yeah.
And there's also there's just all these binary risks in biotech where either it worked or it didn't. And so kind of running the natural experiment of just seeing which families we could partner with, how far we can go, how far we can run. We can run pretty much the whole distance, but it's just not repeatable because there's basically, there aren't that many Hollies out there. There aren't that many parents who have kind of that. She's already a sort of an executive in her day job, and so there's not that many people who have that. And so if you just sort of leave it to chance and you leave it to just which families will organically make it the distance, you're basically selecting for a very small sliver of all the rare disease families out there.
Yeah.
And so, and grinding for 11 years and basically having one, binary clinical outcome like that's pretty fragile. Right. And
So Ethan, like just because I think sometimes people who are following BSci and like trying to follow science, like, we're obviously live streaming an experiment right now and we're moving through various animal models. And I think that the model that Pump Science is optimizing towards is like high throughput science. But I think when you move into humans, I would love for you to share like, okay, 11 years, and you said you moved from N of 1 all the way to phase 3. How long did that take?
Yeah, so that one program, that the N of 1 started in when COVID started, and then within a few, so yeah, basically it was 5 years to kind of get to a phase 3 answer, but but then there was like 5 years before that. And so, because that's, factoring in when Pilar started, although we didn't really start working on this program until 2017. So in any case, it's all very like, it's just, the N of 1 is amazing because you can just actually, move into patients much sooner than trad bio thinks is possible. But then, the downside of that is it's N of 1, and you have to kind of spring up an N of 2, an N of 3, N of 4 to really start to build conviction. And you see 4 little mice here, right? So you don't just do N of 1s in any system. You have to have kind of just independent replicates, right? And then human beings are going to be different than like isogenic, mouse, siblings. So you had to factor in all that stuff. So, and I like to talk about 1 to n, because I don't want to overemphasize the oneness of that first patient. It's just, there was a pioneer, somebody first. Brian Johnson, he's a pioneer. He's very strategically taken advantage of N of 1 and kind of become like this N of 1 marketer, which is great. But, at the end of the day, you're going to have N of many before you start to have conclusions. But in the rare disease world, especially for tiny, tiny, tiny diseases, you're not going to get more than, with one group we work with, there's only 6 patients in the US that are identified. What are you supposed to do? You can't manifest more of them. So we have the numbers we have. How do we design clinical trials and get to success, given that reality, and given that's 90% of the 10,000 rare diseases fall into that bucket? There won't be 6 only. There's certainly more out there. They're just not diagnosed yet. We're only talking about America usually, so it's a big planet. So there's a vast undercount even when you just talk about an ultra rare disease in the US. Curetopia has a truly global vision. But yeah, we start kind of in the place we know best, which is kind of the US, where there's the most resources, the most families who are kind of already organically doing this.
It's so interesting too, because I think exactly what you talked about, you could be talking in the case of my friend, there's 135 people globally, and the other problem is a lot of those cases are actually children, because data was actually the problem. We've now gotten into a lot more genetic testing and screening to get to this information. A lot of people who have this condition are, the adults aren't captured in the system. So there's a huge data gap in terms of there's the identification of rare disease, but then I really feel like that's starting right now. I feel like in the last I could be off the mark and let me know, Ethan, but I feel like in the last 15 years, genetic testing and really documenting and doing genetic screening. And you might do genetic screening, and at the time you do it, there is no marker. And then maybe you get contacted X amount of time later when there's enough data. But I think this data gap is a lot of even too what we're trying to solve for is just creating data so more people have visibility and access to information, because you really need data to try and even get to more meaningful studies, more meaningful outputs. But would love to hear if that's real. I could be.
Yeah, no, I mean, this is why DeSci now. You can imagine getting your genome, sequenced telomere to telomere. You can imagine all of that being put on chain. You can then have compute assigned to that genome and interpretation, insights. You can track all the contributions of data scientists or anyone analyzing the data. You can reward them, right, for participation, for insights. And then you can kind of keep going from there all the way up the stack, where as you go preclinical, as you guys are doing, at some point you can do proof of invention, let's say, or all the data's, not necessarily all the data needs to go on chain, but you're, at that preclinical stage, you're also transparent, audible, high throughput. And then you get to the clinical stage, and I would say you get high throughput not from each individual rare disease community, but by doing them in parallel. Because if you can put 100 different 100 group, diseases, then all of a sudden, you start having some significant N. And then of course, as families and patients contribute data in the real world with testing interventions, they can get rewarded and so forth. Imagine you kind of can get an airdrop if you all sort of contribute data, and that leads to the validation of a biomarker, which then goes on to be used as a clinical outcome measure. And as I know, if you don't have the right phase 3 outcome measures, that's the future of your trial right there. So imagine if you can have rock solid our problem with our phase 3 that failed was that we didn't have rock solid outcome measures that we knew could survive in the real world. We had kind of an extrapolation based on an N of 1 or 2. We can now get rid of all that, because we can also add high throughput, because everyone has a phone and every parent can record their kid. And so you can start imagining creating all these, these decentralized clinical trial data sets where the families really are owning it all,
Yeah.
and it all goes back to maybe when they first got their genome put on chain, right? And so you can see from end to end, there's a DeSci vision where the patient has truly been centered. They've been centered on chain. That's the part that was always missing before.
Yeah. No, totally. I think it's super interesting too. Like I was reading an article yesterday about a little bit of a like a digress, but like I was reading an article yesterday about a gentleman who works in AI, and unfortunately his daughter, this is not rare disease, 24, had like a really rare brain cancer and like had tumors, and they were actually taking all of her information and putting it into AI models, and were actually better anticipating like what was coming next, what potentially her progression would be, what the data means, what her scans meant. And like you even think about like what you're talking about, Ethan, like if you can get all that information, not only like for like collecting of information, but I think people are actually now able to like use AI to extract insights from information, where before it maybe was like more just like one way, like a one-way street, like here's my information, I know, and I think obviously in the Web3 world we want people to have control of their information, but I think now people can start to say like, what does my information mean? Like what does this mean? What are you finding? What are the insights? And like that's something that we're thinking a lot about in terms of like, if we generate all this data, how can we also use AI to help inform, whether it be like personalized supplements, or like understanding like where you're at, what's changing, what improvements are you seeing. So I feel like now there's like this really convergence of a lot of things coming together, where people can, like DeSci is creating ways for people to participate. There's now like ways to, like I'm wearing my ring, but like you can like really easily capture data and have control of data, be incentivized with participation, but then also even like the processing of the data, which is I don't think has really been there before.
Yeah, it's Cure GPT is coming, and it's great. It's just I was running Perlara as a consultancy, and you could fractionalize like PhD brain power, but we won't need to do that really anymore. Or the human scientists will now be freed up to do to go up the stack more, or to just focus on kind of being creative, because hopefully that's where we'll still keep our human edge as scientists. But AI agents are going to be able to read a corpus of millions of papers, right? And then we can interact with it, through models, and very specifically trained models. And that's, and we have a fleet of these, like, and everyone will essentially have their own fleet of AI grad students, right? Constantly asking questions, constantly looking up stuff, and everyone will have one of these teams. So that's just in a world of abundance. That's obviously going to be really cool, but it's not here tomorrow. So
so what are the scarcities? I think this is the important question. When you have like infinite intelligence and like growing data sets, like what's limiting? It's like, and it's probably what you see in the parents of these kids with rare diseases. It's just like desire to fix the problem, right? That becomes the scarce resource. Is someone to actually go and put the pieces together to find, like something promising. And so I think that's what I've always like found so interesting about the work you do, is like, you have the researchers who are motivated to get funding. You have the pharma companies who are, and small biotechs who are interested in, turning a profit. But you have these parents that are just like, they're not trained, but they just are as motivated as probably anyone on the planet to solve a problem. Right.
Yeah.
And so when you have, abundance of basically everything else, like that becomes the limiting factor. Right.
Yeah. I think I've kind of seen that now for many years, and it's not an obvious insight, or as I shouldn't say, it's something that you would obviously just sort of theorize to be the case. Like, you just have to meet these parents and realize one after the other, it's obvious. I'm a parent too. I totally get it. And, my younger son has a touch of autism, as the Zoomers say. But I have a very diluted experience, form of the rare disease experience. But it's these parents are repeatable, but then it's not like they're they're at is the scarcity, right? And that's why the trad bio way of sort of working with that scarcity didn't quite work. And I think what we now realize is that, oh, we learned all these playbooks working with these exceptional parents, just like YC learned a bunch of startup playbooks working with like the Gary Tans and all the young Sam Altmans and all those who went on to be great. They create scalable playbooks. Even though not everyone founder is a Sam Altman, you can create scale books how to start a startup, right? And it was based on the learnings of this core set of pioneers. So I think very similarly we can have like these exceptional rare entrepreneur parents, the ones that I have the privilege of knowing, becoming friends with, working with now. They are creating the playbooks at this very moment. Perlara has too, and some of those playbooks are being scaled through Curetopia, but really that knowledge base that they have, and just taking that scarcity, taking that passion and desire, and trying to kind of productize that in some way. That's what I think the Web3 potential is, and that's why I'm so psyched for Curetopia.
Let's go.
Oh, it looks like our furry friends are back.
No, these are new ones. You've got yourself some new ones. So these are the ladies.
No. So, I see. No, got it. Yes, cleaning for females. Okay, so.
Yeah, so we have the mice separated by male and female.
Yes, this is very, I get it. This is very Orthodox Jewish. I get it. My shul, I'm very familiar with this.
Shabbat Shalom.
Yes, exactly.
So on the left, we got Lee Mice Hamilton. In the middle, we've got Lionel Mousy. And on the right, we've got Alex Rodriguez.
Endless puns. I love it.
Named by the community. By the community. For the community.
Crowdsourced wit. I love it.
Yeah, it's interesting. So we, just a quick recap for folks who might be dropping in. So the way that this was designed was that the rod would spin for 5 minutes, and we would see how long the mice would stay on the rod. These mice are aged. So we felt like in the study design, 5 minutes it seemed like a reasonable like goal, I guess you can say. And what was happening is we had a couple mice the last few weeks actually stay on the rod for the full 5 minutes. So we weren't able to see, it was great that they were hitting the 5 minutes, but you couldn't see how far beyond the 5 minutes they would go. So in particular, this, the middle mouse here with the crown, with the crown on, Lionel, the last few weeks has been just crushing it on the rod and just sitting on the top because she's hitting the 5 minute mark. So we just got approval this week to let the rod spin up to 10 minutes. So it'll actually be really interesting to see the outcome of her performance, because we've been capping it, or it's been inherently capped, I guess you could say. So have been able to optimize a bit for what we were seeing. So Ethan, I think, for all of us here, like we're building in the longevity space, which longevity is something that, like we feel like is a big area of interest. And obviously, like the FDA doesn't consider aging a disease. I think in your world, very much like rare diseases, it's just getting, I think, those rare diseases on the map and getting over some of that like early research and de-risking some of that.
Mm-hmm.
I think obviously like being tied to crypto and Web3, market sentiment swings with the markets. And so, for us, I think I know you said you're like in like battle mode. I think us too, like we're still very much the science must go on, because there's like, we're all getting older by the second. And so we want to figure out like optimizing, for health span and longevity, and just same thing for you. Like there are people who are impacted by this stuff. The mission continues, whether regardless of where the markets are. So would love to hear, Ethan. I think, I don't know how much you can share, but it seemed like there was potentially like a lab update or breakthrough on your side.
Yeah, I don't want to. We're going to do a proper, I guess,
Okay.
edition on Tuesday.
Can't spill the beans totally. I
Can't,
get it.
yeah, I can parcel out a few beans. So if you go to the Curetopia site, we have a test flight project. It's one of these. It's one of the 1,500 inherited metabolic diseases that represent about 10% of all rare diseases. So it's called AARS2, and it's part of a family of other related metabolic diseases, all involved in the protein alphabet, right? Proteins are made up of amino acids, and there's 20 of them. So we looked at one of the letters A in this alphabet of molecules, proteins that are involved in kind of the building blocks of creating proteins. And we created a yeast model, as we've done it over a dozen times. In each previous instance, and this was for another rare metabolic disease, in those cases, we've always run a screen and found high throughput screen, and we've always found a hit, at least one hit that was clinically actionable. And then I think over the course of the last couple of years and over potentially close to 24 projects, somewhere between 75 and 100, kids or young adults have taken some supplement, usually coming from one of our screens. And I'd say a bulk of those screens were all yeast, and it was like going straight from yeast to mice. No offense, from yeast to human. No offense, mice. We didn't have to do any mouse work. We went straight from yeast to kiddo. So that's the power also of repurposing, and that's the power of working with these very incredible, rare disease parent pioneers who are willing to take these risks of, yeah, I'll have my kid try, vitamin C, not so risky necessarily, but you never know. You could always have some weird adverse reaction, even to something common if you're a rare disease patient. So we picked this. We had worked on a couple of other related metabolic diseases to ARS2, to RS2. So we were pretty confident like it would work. And so, there's lots and lots of rare diseases to choose from. This was not like trying to single out anyone in per se, but we do see a longer term strategy of working with this particular foundation called CureRs, which represents a whole family of these Rs proteins, these building blocks. So, and one of the moms who started that CureRs umbrella group, her daughter is Aubrey, and they're featured on the project page on the Curetopia site. So we kind of tried to stack the deck for our first project because we didn't want it to flop. Obviously, you want your first one to go. So, in sometime in December, we got the go ahead because we incorporated Curetopia at the end of November, and then Bio gave us a grant, a 100K grant, to try to generate some results before the auction, and that's exactly what we did. And on February 5th, we got the results, actually. And what we found was, we ran our process, and this is what I'll go through on Tuesday. We ran through our yeast-powered drug repurposing workflow, and we arrived at multiple hits. I'm not going to disclose their structures because the data we have constitutes the basis of a provisional IP, provisional filing. So we're going to hopefully get our first IP NFT minted, within weeks or months. And we have the core of the data set already. And this is before the auction. This was converting 100K. I saw some tweet yesterday. Well, some crypto KOL, DGen influencers like, what could I do for the 100K? And I'm like, you can find a rare disease medicine. We just did it. So, yes, we haven't, none of those molecules have been tested yet in kiddos, where we now have two parents, one in England, one in America, who have kids who are going to be the pioneers. We're just sorting through now the top compounds and what other checks we need to do. But we've kind of set up this N of 2 study that will hopefully launch in the next few weeks, months. So we're really excited to kind of just hit the ground running. And we have a plan, hopefully, depending on the size of the treasury, we have a plan to scale up from 1 metabolic disease to 60. And we've never really ever done that many. And we're going to group them in very strategic ways, where 20 of those 60 will be kind of this contained unit of metabolic genes. So yeah, and what we know is that almost all of the hits we get from these metabolic disease screens are supplements, right? Like sorbitol palmitate, various kinds of fatty acids, NMN, which is the one I'll feature in the case study next week. NMN, like I'm sure you put it in your smoothie this morning. Like everyone, like these are highly accessible molecules, and actually none of them are approved, right? And that's kind of what's been the virtue of them is, oh, we could use them because there's no need for approval. But it goes the other way. Like if the priority review voucher programs are authorized, then like something like NMN could technically be approved as a drug and be worth a lot of money.
It's off the market.
Yeah,
it's a supplement.
Exactly. And so then on the supplement side, it can now start to carry medical claims, which before, obviously, the whole pale again on these molecules that they don't have like certified medical claims backing them. But you can now kind of run this process in reverse, where you take the supplement that was kind of mass market, show that it actually could be a drug for this niche metabolic disease. And as you do that over and over again, you start to realize, oh my God, maybe I'm building a longevity stack on the back of all these metabolic disease treatments, right? Because in one case we've even, because there's actually literature showing that rapamycin, this was Matt Kaberlein, so you guys know who I'm talking about.
Yeah.
He showed that the NDUFS4 Lee syndrome, which is mitochondrial disease mouse, this is years ago, was rescued by rapamycin. So there's already this beautiful result that connects longevity in adults, normal adults, with like longevity in children with metabolic genetic diseases. There's a genetic wormhole connecting these two disease states, and one is very niche and very small, and one is universal. And so if you can create a conduit where you can pass both ways in that wormhole, that's kind of the promise of Curetopia. So in some ways, Curetopia is a stealth longevity company because it's not just metabolism. We're going to find that other processes that contribute to aging, they're all going to cause rare diseases when those individual genes are mutated and you have a child born with it, if that child could even be brought to term. So you're going to be able to sweep across all of biology through rare diseases. And when we're going to strategically focus initially on those rare diseases that are models of longevity.
Super cool. Yeah, no, honestly, I think it's so awesome that you guys are just screening what are the most accessible molecules first. Maybe you're looking for some sort of like IP claims, but
a method of use, and those are totally legit IP claims. And then the cool part is that like the data set we have from all this repurposing is a training set for Gen AI and for AI drug discovery. That's what like no one talks about, but it's like, don't you get it? Like when we figure out that vitamin C or NMN are doing these things, it's probably something where we can optimize NMN and make it even better, NMN 2.0, and it works better in this rare disease context. And then maybe it works better in its general energy boosting context. So, you don't have to randomly explore chemical space. Like you can use the repurposing hits as leads, feed it to the AI and say, how do I make a next gen version of this that is better? And that has both maybe a health span extending application in normal adults, but also in this niche metabolic population in kids. Like that's the kind of future of AI that I'm super excited about in drug discovery.
Super cool. I think we share the excitement. Yeah, I mean, like, I think it's really cool that like we have the opportunity here to like meme these really well-known compounds that like people know about and have heard about, but don't actually see like the power in it. I feel like a lot of us like take these supplements, maybe they work, maybe they don't, maybe we have some sort of like subjective, kind of experience to it, but then to see what it can do to somebody with a rare disease is insane. So Ethan, like, I guess one big question I have is, these kind of like tried and true playbooks that you have for, kind of like hit finding for these different models in yeast, like, what does that look like? So you kind of identified the mutation in the patient population, you find the equivalent in yeast, you make that same mutation, test a bunch of drugs. And what are you testing for? Like, I guess understanding the assays that you guys are running would be super interesting.
You can't put yeast. Oh, there they go. You can't put yeast on a rotarod, right? So you can't put yeast on a rotarod, right? Which is why people mostly ignore yeast. But then what they don't realize is that the thing that yeast does naturally really well is just grow, just proliferate. And the act of proliferation is itself this defiant act against, mutation and perturbation, right? The fact that a yeast cell could even replicate itself means that every little step of metabolism had to work out just right. So you can essentially use yeast growth as this integrated phenotypic readout of disease state. And so if the yeast are not growing, they are quote unquote sick, they have disease. And if you sprinkle a molecule on them and then they grow, then that molecule is rescuing them. That molecule is reversing disease. So that's the mental model. And then, that means you can rip through screens really fast because there are these luminescence light coupled proliferation assays that people have used for many, many years. You can use them even in bacteria. It's called cell titer glow. And it basically is just a way where you can measure the amount of ATP that was produced by a population of cells. And that ATP can drive a light production by exogenous application of luciferase, an enzyme that creates light. So it's a cool little system, and you can basically just use yeast growth, yes or no, and also obviously how much yeast growth. So it's actually, this is an analog readout, and so you can get molecules that rescue partially, right? So yeast maybe the sick yeast grow better than the placebo treated sick yeast, but they don't grow as well as the unaffected sibling control, let's say. So we'll find rescuers that can kind of go up the ladder, and some of them rescue as well as like a yeast that was normal, which is pretty cool to see. It's almost, we call that kind of complete rescue. And so yeah, that's really the simple trick of it. And then we've proven now with supplements that you can go straight from yeast to keto. You don't need any mice, you don't need any flies, you don't need those. I mean, you can go backfill that and maybe and that could answer some interesting scientific questions. But for the purposes of, do I need this information to get into children? No. Like the NMN has long independent record of use, and so you may have to adjust for pediatrics and for smaller bodies and different PK in kids. But like, hey, you don't need a mouse to give you that conviction, or if that's what you need, then and that's the academic way. Honestly, that just drags out the process. If you want to work with a parent, they're like, I don't need that extra information. It doesn't help. I'm just going to try the NMN. I'm going to order from Amazon. I'm sorry. That's what happens. Like, I mean, I remember the first time we did this, and like it was the family working with, there were two doctors, and we got back the list of hits, and it was like alpha lipoic acid and chlorophyllide, which is like a chlorophene analog, and then tyrosine, and they just ordered it that night and started to give it to their baby. So like that was the insight, and that was a couple of years ago. That was the insight that, oh wow, we could go from yeast data, and not even post-processed yeast data, just like fresh hits, just just right out of the screen, right out of the imager, get the data, and then no dose responses, no follow-up, no reordering compounds. They were just like, and I'm like, that's it. And that's only possible because we found these supplements, right? And the barrier entry is like 0. So, and we haven't even begun to fully saturate this space, right? Once we've done all 1,500 metabolic diseases, can you imagine? Like, we're going to know, we're going to realize that, hey, vitamin C works for 10% of all metabolic diseases. And if we made a souped up version of it, it would be a pretty fucking big market, actually. So that's where this can kind of spin out. Sorry, that's a long-winded way, but like,
no, it's freaking awesome.
You start with yeast, and you go to humans. Like that's kind of the hack that we figured out.
It's unbelievable. And I'm just thinking, like, as a parent, it makes sense. Like vitamin C, like, okay, I'll with very few questions, I'll order that and give it to them. When you start like messing with medicinal chemistry, probably get some more questions, but like, sure, for now, just run with it. Like you said, like, I mean, in what world can you have that type of a feedback loop between discovery and in human data? Just like nowhere else.
Yeah, I mean, Brian Johnson, right? But that's only possible because of all that money and just like, but minus that, without that, like, how would you actually create this? And it's like, maybe it's crypto financing. Maybe that's the sustainable loop here that we hopefully are going to untap.
Totally. We think so too.
Yeah. I was like, same. I think it's crazy that, like, honestly, you had said so my background, I worked for a big pharma company, and like literally taking something all the way through the clinical trial process, through the FDA, like getting that all approved literally takes so much time and money and resources, and it's risky and it could fail. And thinking about supplements as like, I feel like supplements to me almost have like a, like, I don't want to say a bad rap, but like people take them for granted because you get a multivitamin and there's like 15 things, 25 things in there, and you're like, this will do. And it's like, I feel like people really, the word supplement, like almost even like erodes the power of like actually what's in there and like what it could do. And I think it's so fascinating, Ethan, talking about taking that and going backwards, like, or maybe forwards, like taking a supplement through the process, and you could test it, you could get it to people easily. People can now like monitor their own outcomes. And it's like, you don't need the whole big system. You can like do it a different way. And I think it's really, really cool. Because that system is honestly, it's a lot. It's a lot. And I think it's really great. And supplements are like what we're thinking about. Like they are really powerful, and you should have a stack. And like, why not have more information and data on your stack and like find the right stack for you? And like you said, make souped up versions of that stack, like there's, ways that those supplements can be iterated upon to make them even more powerful. So I don't know. I just think people, when you say supplements, I think sometimes people are like, oh, I remember some of the narrative going around like D-size shouldn't just be supplement. It's like, hold on a second. Like there's a lot of power in supplements. Like let's not throw the baby out with the bathwater here. Like let's rethink about like what supplements enable and like how we can make more super supplements.
True. I mean,
Yeah.
I've heard the argument that, obviously I think a lot of the blowback from the basically the anti-goop effect, and like, you had a bunch of people in the space kind of promoting nonsense, right? And then
Yeah.
but it's like, if you gave some random person or some person with some common polygenic disorder, you kind of gave them a vitamin and said, this is your cure, that does seem far-fetched. But if you have a very genetically targeted population, like we're seeing in rare genetic diseases, then this thing that might not really move the needle in some other context really can stop seizures, for example, or allow for taking first independent steps and stuff like that. So I'm excited to basically say, supplements and nutraceuticals are this hack, and let's take advantage of them, but let's not overpromise. Let's also realize it's not going to be monotherapy, whatever it is. It's going to be some combination therapy, and if we accept that, then we can just put out the data and show these are what these combinations do, and then people can judge for themselves.
Yeah, I have this mask. Well, you can't really see it. I had the mask on because I obviously have kiddos, and you say stop seizures or take first independent steps, and like to parents with kiddos, man, like those are like they sound so they're so profound. Like first independent steps or being able to stop seizures in your kid, like that is so powerful. So just like grateful. I'm grateful for the work that you're doing, and hopefully too we can find ways that the pump science research protocol maybe can help too, or I don't know if it could loop back around and we could get additional data for stuff that you're testing. But I think like obviously we're all in the DeSci world and sit very close to crypto, but the mission is so great. It's so great. It actually touches lives and people, and people are hungry for crypto to have real world impact. Like tell me something greater, something more impactful, like I'd love to hear it.
Well, I don't want to be a shameless pumper, but Cures, go check it out. Auction is live. $Cures auctions live on Solana, and powered by Bio through March 11th. Hopefully Sol has bottomed this week and we have some tailwind. But
you heard it here first.
Yeah, at last check of the auction, we're at over 100K, 110K, 113 participants. So I feel like going out in the worst time, or this flash crash moment, and still having traction, I think is going to do us well. And we still have what is it now? Let me look at the latest count. We still have basically 10, 11 days left in the auction. So I know a long auction means a lot of kind of doldrums, or periods where it's going to kind of just sort of build gradually, and that's where we are. But hopefully starting next week on Tuesday, we'll have this great call, because we were also going to be partnering with MiraDAO, and the Mira coin story, which I know maybe you're familiar with, this Christmas Day rare disease meme coin miracle. So we're partnering up with that group. We're going to announce that. We'll drop the ARs too, sort of high level results. So next week we'll really start the push the charge here. Yeah, Tuesday, March 11th is when the auction wraps up, and then really excited to just get back to grinding once the auction's over and starting to deliver results.
Well, happy you made it. You should make a plug, because what you're doing is so incredible. So people who just joined or don't know, Ethan is joining us from Curetopia. Curetopia is the first BioDAO in the Solana ecosystem. As he shared, the auction is still open for the next 11 days. We are so grateful that you came by and on Rare Disease Day. So thank you for spending it with us. And honestly, like, we couldn't be amongst a better company in the Solana DeSci ecosystem. I think we're all trying to do like the most meaningful work that we can do and find ways that crypto can power that. So super grateful to have you stop by, and would love for this to be an ongoing conversation, and
Totally.
Even to find synergies between what we're doing and, you know, like I said, how we could help you, how you could help us. But yeah, I think I know we're in good company, and just grateful for everything you're doing.
Yeah, well, one day we can have split screens where you have your mice on one side, and we can have kiddos with their before and afters on the other, and
Oh
then
my God.
24/7 live stream of DeSci regen.
Let's go.
Hope.
Let's go. And you know what? Those kiddos, I think, would appreciate my Darth Vader mask. I will
Totally.
say. I think they would appreciate it.
Totally.
Awesome. Well, if there's any questions, I know we're on a stream, so it's not as easy as a space, but drop them in the chat. We're happy to tee up anything to ourselves. Ethan, I haven't seen anything come through, or I would have asked, but
no worries. I actually do have to hop to hit up. I'm in East Denver, so I do have to hop to hit up some on my last full day here. So maybe if you don't mind, I might just I might drop off the rotarod.
Drop off you and Hope. I don't know. You might want to just wait 1 second for Lionel. Let's see.
True.
Let's see the legend. I started the timer late, and it's at 5:48. Just so you know.
Wow.
So she's already exceeded. She's went like full.
Someone's been feeding her M&M.
Oh, sorry, I jinxed. Damn it! I knew I was.
Oh, that's all good. All good. Well, thanks for stepping through. Especially, I know East Denver is crazy, so we'll let you go. But yeah,
crazy is this wallpaper.
I was wondering what that was. I was like, I thought it was like an Afghan.
No, this is this urban cowboy hotel in Denver, which does have a copper bathtub. It's got some interesting touches, but
swank pad.
I'm looking for a different place tonight. Let's just say that.
You know, it did match the RODeo theme quite well. So
True.
I mean, I thought you planned it. That's how you planned it. Awesome. We'll have a good one. And yeah, if anybody has any questions, drop them in our Telegram. We'll make a connection. But just a reminder, the Curetopia auction is open for the next 11 days.
Thank you both. Have a great day.
You too.
Thanks, homie. What a legend.
Man, I tell you, like,
literally doing God's work.
God's work. It's crazy because, like, I mean, it really is like crazy to think that he could do tests in yeast, and then like the parents can be like, okay, I'm gonna go order it and do it tomorrow. I mean, it's like a similar model to what we're doing, but like you think about testing it in a kid with rare disease and immediate application, that's crazy.
It's crazy. Yeah, definitely inspiring in terms of just like being radically focused on solving the problem, you know, not focused on like the business model or like how this thing's gonna, you know, pay for itself sustainably, but just like providing the service to parents to cure their kids of rare diseases as quickly as possible,
as fast as possible, and like thinking about the model literally on its head to do it.
Yeah.
Like,
and also just like fighting as much as he possibly can to get any sort of resources for it. It's like, how do people not see like the value in what he's doing? There's no one like him. Anyway.
No.
Super duper inspiring.
It's I know I shared like I woke up this morning and I saw that like fundraiser, and it's like I think too, to think about like the scale of like what he could do. It's like, oh, if $3,500 is over here in one pocket and $3,500 is over here in another pocket versus like channeling it in for infrastructure that could serve like multiple rare diseases. Like that to me is like efficiency, right? Like I feel like the system is so fragmented, even within rare disease, like to channel that all together and create a system that can have a lot of impact really fast is really freaking cool. Really cool.
Just
yeah,
cure
machine. Wild.
So
I know. I thought it was really interesting too that he was talking about like the synergies between like metabolic disorders and longevity. Like there's, I don't know, I feel like there's more we could do there too.
yeah, I mean, it'll be interesting to see whether you can get like translation between somebody with a rare disease and what they may benefit from, and then your average person. You know,
Yeah.
I guess, yeah, I'm curious to see, like, you know, yeah, does it generalize? I think that's a big question, but
Yeah.
I think what he's saying makes a lot of sense.
Yeah.
You know, these genetic disease, like, there's so many ways that your genetics can go wrong, and they are finding, you know, everyday off the shelf supplements that work and like actually can, you know, it's just basically like supplementing with what is directly limiting, and like maybe for all of us it's limiting a little bit, and for these, you know, people with rare genetic diseases it's limiting much more significantly, and that's why they see such a profound effect. But yeah, I mean, like, it makes sense that it would help the average person too. But yeah, I mean, even if it doesn't, just the fact that it's powerful for, you know, those 10 kids
A
who are suffering.
subset, yeah. And like
so cool.
with a little bit of information, really at a high throughput rate, like they could do something tomorrow. Like that is wild. I think the part that's like, I don't know if we didn't really go into it, but like one thing that's been so crazy to hear from my friend who's going through the rare disease journey is like navigating the insurance system. Like it is, because like there's not a lot of information on, you know, this certain type of rare disease. And then as her child has gotten older, like getting access to resources, like a lot of it is not, it's really hard getting insurance coverage for stuff, and like having the right coding in the system. And then there's like coding.
They might not even have a code. Like,
no,
it might
they
not.
literally don't.
Yeah.
They don't. And then like, but what's crazy is like, you want to talk about stuff that's wild. Like, okay, if you, in one case, they were trying to get this rare disease has almost like presentations that can feel similar to autism. And so they were thinking that like, oh, if we get, and if our child also has you know, a diagnosis for autism, that will help with getting more resources. It actually didn't, because the genetic code trumped the autism diagnosis, and it like actually made things, they thought, they were hoping it would make it easier, made things harder. So it's just crazy. Like you want to, that's like a whole nother rabbit hole, but like it's to be able to, I guess what I'm saying is to be able to like wake up and be like, vitamin C, let's order it tomorrow. This will be the most impactful for my kid. Like how freaking powerful, when the whole, to get actual resources in the system is really hard. It takes a lot of time and patience and phone calls and sanity checks. It's like that. It's freaking awesome. It's freaking awesome.
Yep. And like, you don't need insurance if you're ordering vitamin C, you know?
No, Amazon, like call up Amazon pharmacy. Crazy town. Crazy town.
Yeah, literally, you don't even need insurance. It's like you just take NMN and vitamin C, and like
literally,
it's there awesome. Tomorrow.
Yeah,
what is
wake
this world?
Tomorrow.
What is this world?
Literally, what is this world we're living in? I know.
Like,
I know.
Farm at the speed of light. Like, just think about like how many steps it takes from like discovery phase to, you know, approval of a typical drug. Like, you know better than anyone.
Oh my heavens.
Just going from like a yeast study to like Amazon just delivered it, and just the kid's already like showing a sign of response.
And then like it does so well that now they're like oh, now it should have like an FDA indication and now it can be a medicine. Like, wait, what?
Yeah.
Huh? It's wild. Wild.
I
I
mean,
honestly feel like we're living in like, whether it be the, you know, so many systems I feel like are being disrupted at the moment, like media and I mean clearly like, the financial system DeFi has been trying to make new rails for that for a really long time. Now we're like dismantling the NIH is currently having challenges, but creating new ways to like put the power back to the people. The time
Totally.
is now. The time is now.
The time is now. But also, it's just like all of these things are all just accelerating for the most part.
Yeah.
Except in healthcare, outside of DeSci, like outside of what like Ethan's doing. I mean, I don't think the process is getting faster of like getting a drug to market. But
No, it's isn't there like Eram's law? It's like everything else is getting faster and this is actually getting slower and more expensive.
yeah, but here's the crazy thing. It's like there's so much development going on in China because they're faster now because they have less regulatory red tape that like so many of the biotech companies are now looking to China and like the chemistry that's coming out of there because it's just faster. It's just faster. Speed is everything. And
Speed is everything.
we think of ourselves like the US being the biotech powerhouse of the world, but so long as we're not the fastest, this will not be the hub of innovation. And to me, it's like this is the message you need to get to regulators. Like, if you want America to continue to be like the pharmaceutical powerhouse, and this be America be the place where medicines get developed and invented, like you got to speed things up. You have to.
Gotta speed it up.
Otherwise, yeah, China's freaking kicking our butts.
Well, like I mean, I think sometimes people think of like speed at like the cost of safety, and it's like no, there's just like more ways you can do early stage stuff. It's not to say it'll be less quality or it won't be safe. It's just like the avenues in which that stuff gets done today really limit what can get done.
Yeah, I mean, it's just look. I think it's just less time where paper is on somebody's desk, like being pushed around.
Oh my gosh, totally.
Like, I don't think it has to do with like, it's not rate limiting on the experiment and like the physical side of things. It's just like, how long does it take to push a piece of paper from one desk to the other?
Yes.
And like,
yeah.
Elon said it well. He's like, it should not take longer for regulatory approval of a rocket launch than it takes to build a rocket. I think it's the same thing with drugs. It should not take longer for regulators to approve advancement of a compound than it takes to freaking build and run the experiments.
Yeah. I was impressed that like, I mean, when Ethan was sharing, it took from 2017 to, it was like 5 years. I was like, that's even pretty fast. I mean, I know N-of-1s are probably different, but I was like, man, that's a decently high clip. And
it's very impressive.
Yeah,
I
was like,
there's 6 patients. It's like,
yeah.
What after you hit phase 3, it's like, what's left? Like, there's no patients left.
Yeah.
And like, what is phase 1? Is phase 1? Is phase 2 2? And phase 3 is 4 people.
Yeah.
And then everyone in the whole country who has this disease is on the trial.
Yeah, you're like, wait, it's really, yeah. That was it. There you go. Is this Lionel again?
Yeah, Lionel's freaking crushing it.
I have the timer going. I think I missed the start, but okay, that was 4 minutes. So that honestly, last round, man, Lionel just like.
Oh, sorry, that was Alex, I believe.
Oh.
Tough.
Sorry, Alex. We didn't even give you credit where it was due.
Yeah.
Didn't even give you credit. Okay, wait. Do we have one more round left?
I don't know. I think that might be it, fam.
Was that it?
That's the RODeo.
That was the RODeo.
That was the RODeo.
I was so captivated by our discussion. I blacked out for the RODeo.
Blacked out.
She blacked out for the RODeo. Okay,
Well-
well, do you want to just give a quick recap too, like the upcoming science that we have?
For sure. So, yeah, I mean, in terms of the 3 compounds that have been launched, so Gaussy, artemisinin, and EGS. So I think artemisinin and Gaussy have raised enough funding for their next experiment. I don't believe EGS has raised enough money. I'll need to go double check. We'll hopefully get how much funding each compound has raised in the UI soon, but I don't think it has yet raised, which is a huge pity because it deserves to advance. Like it
Looking
is
good. Is that the
yeah.
one you could drive the Mack truck through?
You could drive a 747 between those
That
curves.
curve separation.
Exactly.
Heard it here first.
So I really hope that we get the opportunity to test it on the flies because it 100% deserves it. And yeah, so like that's for the 3 compounds that have launched. In terms of Riff and Euro, we'll keep getting tested on the mice. We're also like here's kind of like some alpha is we're working on a supplement for Euro at the moment. So basically, I think the next step for Euro, or kind of what we've decided is we want to get in people's hands. Our goal with pump science is like meme compounds that we think are powerful and what the data shows is powerful. And Euro seems to be. I mean, like we'll see what happens with the mice studies. They're not done yet, but from the initial 2, from the flies and the worms, like Euro's looking great. And, we think that more people should be taking it that know about it. And so we want to bring it to the people. And so we're developing a supplement at the moment that will hopefully distribute to, as many people as we possibly can in the crypto community, out of the crypto community. And yeah, just like show the power of the supplement, kind of coming back to what Ethan is talking about, like, all of this is just like biochemistry, whether it's considered a drug or a supplement, it's all just different labels for potentially powerful chemistry. So, yeah, Euro seems to be super powerful and we want to get into people's hands. So, we are currently working with manufacturers to try and find one that will help us distribute Euro. So, and then as for Riff, if we can get basically the revenue from the market makers, then we can fund a cat study. But until then, we'll also have to wait and see what happens with the mice to see what can advance.
Yep. And one other thing too, to just let people know, we are hoping to get new science going on the wormbot machines. So if there is a supplement or something that you want to test, please go to our website and hit request new experiment. Just a reminder, it costs 3 SOL to run the experiment. And so you will have to pay to 3 SOL if you want to run the experiment on the wormbot machines. But when the token launches, if it bonds, you get the 3 SOL back and a percentage of trading fees from the compound token. So if there's something you want to test, please head over to the Pump Science website, make a submission. It can be a single supplement. It can be a cocktail of supplements, but you heard it here first from Ethan. Supplements are powerful, so let's put them to the test. So pop over there and submit a compound. We're ready to do some more science. Let's go. All right. Well, I think that's it. Is this it? The end of the RODeo?
That is the end of the RODeo. Thanks to everyone who made it this far.
Yes.
I'll be surprised if someone made it this far. You're a champ if you did.
Well,
you deserve all the airdrops.
All the airdrops. Well, if there's a guest who you want us to bring on, drop them in the comments. I think we're realizing too, it's great having more projects, more people on here to just create awareness for DeSci and what everyone's doing, building. So drop people you want to see. And yeah, I guess we'll see you same time, same place next week.
Can't freaking wait.
All right. And the science continues. Over and out. Bye.